No pinch in the anterior hip for you? Yeah. Okay. And as I went across, it increased a little bit more. Okay. So I'm just going to get on top of the ASIS. Going to release a little bit of the iliacus here to open up the pelvis a bit. And it feels different than the other side, actually. I feel the tension is the same, but it feels like it's a different location. This is a little bit more medial. Okay. Yeah. Same thing. So I'm just gauging the tissue changes underneath my fingers. It's going up and down with the tissue fibers, hugging the corner of the ASIS and slowly oscillating the knee, looking for those restrictions within the hip. And as I find a restriction, I just kind of hold, allow the tissue to relax and melt and change into the fingertips. It's easing up a bit. Allows you to get in a little bit more deeper depth. Okay, so this is pretty deep right now. You're comfortable? Okay, because I could feel a little bit more ligamentous here. Okay, and I'm still hugging the corner of the pelvis on the inside of the ASIS, just to the top of it. Okay, I'm going to put a little bit of a perpendicular traction on here. So putting direct pressure with my fingers, going a little bit more medially on the tissue. If you get sharpness, kind of let me know, okay? Okay. I'm going to do a little bit of different technique on this one. Because what I'm picking up on this side is a bit different than the other side, I'm going to do a pin and stretch. I'm going to maintain the pressure on the ASIS, iliacus, bring the leg down. It stretches out, ease up in the pressure, come right back up. Pin and stretch coming down, keeping consideration of discomfort within the patient, always checking in because these areas can be very sensitive. As I'm coming down, not only am I doing a pin and stretch with a relax, I'm actually tractioning a little bit of the hip here as I get to the end. And I can feel full length tension, top of the quad to where my finger is as well. Okay, so I'm going to do a little bit of pectineus. Pectineus test, small little muscle in front of the hip. You're going to isolate the SIS down. You can put a little bit of pressure up into my hand here. You can push and then relax. Any pain, discomfort. Okay. And then you can continue here with a little bit of muscle energy work. Push up again, same position, hold for 5. And then relax. As she relaxes, a little bit of passive opening of the hip. We're going to do one more time. Push up again. And relax. And then going to go down again. Good. Always go back to a little bit of a retest. Okay, some adductor work. There's several things that you can do here. You could do trigger point. You could do just soft tissue. I'm actually just going to gauge and depend on what I'm feeling here. Okay, fascial. Minimal fascial restrictions, not too bad. Adductor feels pretty good. Pesant, not too bad. Okay, demo purposes, consent's already been approved. Signing of forms, documentation's been approved. Okay, so what I'm looking for is a little bit of tension. Let me know how you're gauging it. Feel a little bit there, not too bad. Okay, as we go up a little higher, more, okay. So looking for trigger points, any restrictions or adhesions on the tissue. And I kind of enjoy this as a therapist, but patients generally don't enjoy this. What I'm going to do next. So there is a trigger point referral, mid-adductors. I can refer up to a little bit of the pubis. So just let me know if that gets too intense and I can ease up in the pressure, okay? So I'm going to put my leg down and use my elbow to kind of glide. And then you kind of gauge me. Okay. A little intense. Can we ease up a bit or you're good? Okay. So feeling for the restrictions as I get up to the longus, magnus, tissues. It does get a little bit close up into the insertion. Coming in fascial line, quad medialis. You can feel the tissues bumping and rubbing. Good. I could hear the breath. Okay. I'm going to get a little bit more medially, but I'm going to use my elbow as I drive up a little bit. Fascial line, this could be pretty intense as you get closer. Coming down again. So we feeling the pressure? Okay. I'm going to hold here. You getting a referral pattern from this? Anything like a circle, like a balloon blowing? Okay. You let me know when that referral pattern fades a little bit. Okay. Trigger point referral patterns. Maintain pressure. They'll get a balloon referral or referral pattern that travels up or down. Maintain pressure about 20, 30 seconds. Once that trigger point referral pattern is faded, you can increase with more depth or you can change location. Okay, good. Now I'm going to work a little bit more mealy, getting into anterior hip, top of quad tendon. And again, sensitive areas, the pectineus triangle, femoral artery. And just relax a little bit. Pin stretching the quad. Tell me when. Getting right up into the ASIS. And now I'm going to wrap a little bit more mealy. Feeling the tissue. And just sideline that way for me. Okay, so just to release a little bit of the TFL here, I'm going to do some active movements with the hip and use the elbow to get into glute TFL again. These are deep tissue techniques. As you're going to feel a little bit of pressure. I'm going to try to watch for facial expressions as they come through, but definitely guideline and verbalize the discomfort as I'm shooting through it. And dead weight. As I'm relaxing, I'm going to assess the hip, continue function, and I could actually feel a change already. It's a little bit of a restriction coming to the top right here. I'm going to get into the hip with the pressure, bring her into hip flexion, open up, a little bit more deeper on that pressure to get into that wrap around that head of the femur into the greater trochanter area. Loosen up those iliofemoral ligaments. The top of the TFL here, highly sensitive area with a trigger point that can often refer down to the knee. And then getting into the glute posterior hip. Good, good. Okay, you can also do a little bit of a pin and stretch here on the IT band. Bring it down and relax. Good. All right, good.